Good. Okay, so I'm going to start by saying good morning, a very good warm good morning from my side. My name is Joanna Hannefeld. I have the pleasure of chairing the Strategic Advisory Group of the EMT Global Initiative. I feel energized and inspired after the discussions we had yesterday, and I really look forward to another day of exchanging on our collaborations, on learning from each of you, and fostering further partnerships. So this morning, it's my great pleasure to chair this session where we will be looking at the implementation of our 2030 strategy. And we already spoke a little bit about this yesterday. We had the landmark in Yerevan 2 years ago where we adopted the strategy. We heard somewhat about the uptake already in many regions, in many countries. But of course, the challenge really is when it comes to implementation. And that's what this session is really all about, is to explore together different perspectives on how we can create opportunities for implementation. So I've got a fantastic set of panelists who will be sharing from very, very different perspectives, from different sectors, but also from different countries, different regions, about ways to promote at national and regional level, about novel approaches around innovation, around private-public partnerships, around being more inclusive in the implementation of the EMT initiative and our strategy. So we'll really be looking at all those different perspectives. How can we learn and how can we use that to practically enable the implementation we have? So to start us off, however, I'm delighted that we have a presentation from Dr. Camilla Lajolo from the Secretariat, from the WHO Secretariat in Geneva. She'll be presenting an overview of the EMT 2030 strategy just to set the tone for our discussion and give us a bit of an update. Camilla, the floor is yours. Thank you.
I started well. Let's see if I survive the end of the session. Where do I click? Okay. So welcome you all. I hope you had a nice dinner last night. And I apologize for any delay with the transfers back to the hotel. So please receive my apologies. I hope you got some rest. So what I'm going to talk to you in the next 5 minutes or so is, let me see if I get it right, is about the objective number 1 of the EMT 2030 strategy that you have there in front of you, which is expanding partnerships, leaderships, and operational guidance. And just 1 second, yeah, just me go back. You know already, I guess by heart, and if you have been at the WHO EMT booth, you have seen this big banner. The vision of the EMT 2030 strategy is a world in which every country has the capacity to respond rapidly, effectively, and flexibly to national emergencies, leveraging regional and sub-regional capacities to support vulnerable communities and people most in need. We have 4 strategic objectives, and our session will deal with the strategic objective number 1, that is in essence an enabler to implementing all the other objectives and achieving the goal and the vision of the EMT 2030 strategy. So let's delve deeper into strategic objective number 1, and if you have received this subway map. It's in every of your bags, because this is kind of our roadmap on how we will achieve the vision of the EMT 2030 strategy. So if you focus on the yellow line, you see strategic objective number 1 and the key actions and milestones that with our current knowledge, we believe are necessary to achieving the EMT vision, the EMT 2030 strategy vision. And I believe that this panel discussion will inform a lot of those actions as well. So in essence, what this roadmap says is we need to promote the role of the EMT initiative to foster partnerships, to strengthen regional governance, to strengthen cross-regional collaboration. And let's see a little bit what that means. We have these 11 global targets that you have seen so far. The targets 5 and 6 are directly related to strategic objective number 1. So how we are going about them. For indicator number 6, percentage of countries with national focal points, we are currently at 66%, and our target by 2030 is to reach 80%. For the percent of increase in established partnerships, we want a 40% increase from our baseline of 46 partnerships. And what we have achieved so far into that specific area. We have launched, and as you have, Flavio has mentioned yesterday, we have launched the call for supporters of the EMT initiative, which is a call for like-minded organizations to promote in-kind support to advance the EMT initiative activities in terms of capacity building, standard setting, information management, and support emergency response. You can find more information there in the QR code, but we had a huge spike in interest with 34 organizations from across the world interested. We have also celebrated formal agreements with the UNDAC from OCHA and WADEM that will help advance emergency operations, information sharing, and the research agenda for EMTs. But I believe just the partnerships are not enough. They are important, they are an important enabler, but they are not by all means necessary in itself. We need to expand to other areas if we are to achieve strengthened partnerships, leadership, and operational governance. And I'll be looking forward to the discussions in this panel and explore these questions even further. This is just a detail of the supporters of the EMT initiative. And that's all from me now. Back to you, Johanna.
Thank you, Kamea, for positioning this discussion and anchoring us. So, as mentioned, we've got a great panel. We've got about an hour and a little bit to hear from lots of different perspectives. I'm going to ask my panelists to come onto the panel one by one, and I'll introduce them before their intervention. So, if I could ask you to come up and take your seats, please. Steinar Olsen, Dr. Hande, please come and join me. Jerry Chandler, Dr. Jerry Chandler, please come and join me. Dr. Ziza Bari, please make your way up here. Dr. Gloria Balboa, and let me not, have I got everybody? Okay, fantastic. So I think we should have enough. Great. Okay. So as Kamea outlined, we will be exploring different questions, and it's my great pleasure. So we'll start off. We have a mix of formal presentations and interventions that will address some of the questions that around the implementation that we outlined. And it's my great pleasure to introduce our first speaker, who is Steinar Olsen, who is not only the chair of the Euro regional governance structure, but who has a long experience in the EMT initiative, who's gone recently back to more clinical practice, the real world, he just said to me, but who is an active supporter of the movement and who will be sharing about the application of the strategy as a framework for implementation. Steinar, please.
Thank you very much, Johanna, and it's a pleasure to be here, to be a part of this community. See if the presentation will work. It's always very interesting. I'm from Norway. It's a country on the outskirts of Europe, up in the high north. Half of our country is beyond the polar circle, and we have a very mixed population. How is the presentation doing? Seems to be some technical problems. But being rural like we are in Norway, it means that you have to have support from others when the catastrophe hits you. Either it's someone setting up a bomb in the Oslo area, or like we had during the pandemic, we need support. So that's why we in the Nordic countries also have a huge collaboration together with other countries, and I'll come back to that. But to prepare the healthcare system, it's not a job the healthcare system can do themselves. To have a prepared healthcare system in a world where we have a diverse situation with pandemics, with war-like situations, we have to see the healthcare system as a part of the whole society and prepare holistically. So in Norway, the healthcare system is not a system beside the rest of the society. It's an integrated system where we are integrated in the armed forces, in the civil protection, as one holistic system. And I think enabling that in the different countries will be one of the steps you have to take. You have to integrate your healthcare system into the rest of the society so we can work cross-sectorial, because we as a healthcare system doesn't have all the resources. That's why we have developed systems together with our armed forces. For instance, the ability to medevac patients inside our country, but also abroad outside our country. And to have the resources to do that, you also have to reach out to the private sector, because the private sector has a lot of resources, and being able to drag on those resources in a catastrophe is vital, because we as a healthcare system can never have a 737 on standby doing medevac if we should need it. But if you have a contract with your airline system, you can have that type of systems. So working cross-sectorial with the private sector is the basis for creating your system. Having that system, it's easy then to go to your neighbors and reach out for them, like we have done in the Nordic countries, where we have a preparedness agreement cross borders, enabling us to call to Sweden, can you help us? Or like Iceland did some 2 years ago, when they had a big fire, they didn't have enough space for the patients. Then the rest of the Nordic countries said to Iceland, send the patients to us. And within 12 hours, we have moved the burn patients from Iceland out in the North Sea to burn facilities in the Nordic countries. So having that flexibility is important. And it's in that perspective, this framework of WHO is vital, because it gives you the tools, the standards, to create this opportunity of international cooperation, cross-sectorial cooperation and innovation. And that's vital. So here's suddenly my presentation. Some of the challenges doing this is the awakening. Every nation has to be awakened, and that you are the most important guys of doing that. And then, as I said, sub-regional acknowledgement and cooperation is vital. And this is how we have built our system from one resilient healthcare system to including research and the private sector, sub-regional and regional cooperation, and this funds our ability also to reach out to the European Union and to the World Health Organization to provide our resources also internationally. And as I said, this is the framework to do this and to set the direction like the WHO has done so marvelous in this strategic plan. So how can we do this and ensure an inclusive and diverse EMT initiative? We have to work in 4 pillars, like was said here before. We have to secure commitment. We have to have quality in the response. We have to strengthen the EMT global community. And we have to enhance mechanisms for sharing practice and knowledge. That's why we in the European region is very keen of getting data to support us in doing this. Without data, we don't have the basis for research, innovation, funding, and advocacy. Politicians love data. You need data to ensure and anchoring your project locally. And then we need tools like we have developed in the European region, the REACH, the competence node in Turkey, where we can share competence throughout our region. It's vital to have a competent body helping us doing this work and securing that we can share knowledge with all the countries in our region. And then we need you as national focal points. We need the anchoring to the region, and we need to engage all the national focal points in this movement of collaboration and strengthening our ability. Because if we prepare together, we become more resilient, and that's why we are here, to do this together. Thank you.
Thank you. Thank you, Steiner. And I think that sets out very nicely the need for the clear governance framework, right? That for the collaboration that you highlighted, and that the Nordic countries in the Euro region really have this very integrated model, which so I find quite impressive every time I see it, because it really brings together all the sectors, but that at the heart of that is the transparency around the information and the clear sense of responsibility and roles. And one of the things that Steiner highlighted in his presentation, and that we'll explore with our next panelist, is around also bringing in other sectors. And I think that's a very clear message also already from yesterday, from some of the opening statements, is that this is really what we need as a whole of society approach, but that the private sector is an important partner here. And it's my pleasure to now introduce Dr. Dee Zibari from AMI Expeditionary Healthcare. She's the Chief Medical Officer there, and she will be exploring a bit how to bring the private sector in. So please, Dee, the floor is yours.
Sure. I don't know if my slides are up. If not, that's okay. I can just get started. Up, down. Okay, thank you, Dr. Hande. And yes, like she mentioned, I am the Chief Medical Officer for AMI Expeditionary Healthcare. We are a US-based private company that deals mainly with disaster response and crisis response domestically, but also globally. Our DNA actually started in the international countries that we're currently servicing, but then we also developed our services inside the United States, working alongside the DMAT teams and national disaster medicine and federal government, state, local entities. Thank you. Thank you, sir. All right. So I think one of the key components, what we're talking about, is the strengthening the partnerships with WHO. And one of the things we've done previously as AMI, we've worked directly with WHO and some of their initiatives on a global scale. And what I'm going to discuss today are 2 examples that we've done, or case studies that have actually been published, and you can actually find it online. And if you, I'm not going to go into the details, but if you like further reading based on these case scenarios. So essentially what the role of the private organizations for us was to strengthen the response in an actively, rapid, efficient manner. Because sometimes when the local private sector is debilitated, there's not enough resources to engage the current local entities. So bringing in private sector will make sure that you have a rapid response to get to as fast as possible to the people who are the most vulnerable at that time. So the first case scenario I'm going to discuss is the Battle of Mosul back in 2016 to 2017. This was actually very, very big deal because it was the first time the WHO, and I'll get into the examples of this, contracted a private organization, and it was the first time WHO actively responded to an active combat zone in the scale that it did for this example. A couple of organizations that were involved, it was a multi-agency response that involved multiple actors from across the government, the private, the NGO, and international NGOs included. I put up there some of the names, and this is not all inclusive, but mainly the big ones that were involved that led some of the field hospitals, but there were also fixed facilities, hospitals, locally chosen by the military intelligence sector that told us where to go to develop these whether they were trauma stabilization points or they were the tertiary care centers for the civilian casualties during that war. So why was this such a big deal at that time? Johns Hopkins actually did a case study on this, and they published it. It's like a 40-page case documentation of this response that WHO led. And like I mentioned before, this was the first time that the WHO initiated such a massive response, including the private sector, but also engaging in such close proximity to active combat zones. Nowadays, it's very, very common for WHO, as we know, the environment has changed on a global scale. They're everywhere in terms of active combat zones, but this was very, very new for them at that time. So what was the role of WHO? They were coordinating, but they also had the standards of care created for this initiative. What we did with this, these are a couple of things why it was such a new concept. And the other point that we want to highlight is the idea that the NGOs, the WHO, and the private sector utilized the military trauma system that they had deployed, but now we were bringing it into the civilian sector. And what that means is we created trauma stabilization points at the point of injury, or the POI, and ensured that the field hospitals and the fixed facilities that were given to us by the military intelligence were within a 1-hour limit to ensure that golden hour, as fast as possible, stabilize the patients, get them to the terminal care that they needed, not terminal in terms of what we normally say in healthcare, but ensuring that they are stabilized, and if they need further care, evacuation to much more higher level of care. The other point that WHO did, this was very, very new for them, is they ensured that their field hospitals and fixed facilities were as close to the combat zone as possible. Again, it took that military model and ensured they could get as close as possible to where the injury would happen to civilians. This was not for military. Military already has quite an experience when it comes to POI injuries and ensuring the DCR and DCS are done. This was very new for the civilian sector. Again, the other point is the idea about the private sector, which was us, and the coordination with the military forces. One of the things they had to ensure that was maintained as a NGO, WHO being one of those, is to ensure that there was impartiality and neutrality. But in this instance, they needed major military intelligence and security forces because of how close they were to the combat zone. The other case example I want to get into is the massive Ghana COVID-19 field hospital that was, again, WHO contracted out to 2 private organizations, AMI being one of those, and then CADAG. With the roles between those two, CAG did kind of the logistical and wraparound services, and AMI did the clinical medical personnel for this initiative. And what we did was the efficient and rapidity of how fast this field hospital was created. It was modular. It took about 7 to 14 days to build up a 50-bed facility. And the difference between this field hospital or COVID-19 field hospital, as you had seen being done in other areas, especially in the United States, was the problem with taking care of high acuity patients for COVID-19 patients. By that I mean being able to provide high level oxygen with the ventilators and high flow oxygenation was a big, big challenge. We were able to do this and create the oxygen ability to give to those patients at the field hospital. And one of the other key components was the idea of creating a central hub for where these patients, to take the burden off of the local healthcare system that was already struggling as much as it was possible. We created a central location for the field hospital so all local hospitals can transport their patients to the field hospital. And I'll end it on here. I think as we continue to develop the 2030 EMT initiative, getting the private sector involved in these combat zones, or whether you're talking about natural disasters, as we're seeing with, climate change, we're going to see a lot more man-made combat active zones, and we're already seeing it. We got to utilize all the resources we have at hand, and the private sector already has kind of the intelligence, the innovations, the ability to get personnel to the places as soon as possible, and we just need to ensure that we utilize them as best as possible. That's all.
Great. Great. Thank you very much. It's very interesting. There's two very practical examples. Really interesting about how that worked with a modular approach. So another aspect that the EMT that we have in the strategic objective 1 is really around the diversity and the inclusivity of that leadership. And it's now my pleasure to be jumping to the other side of the world a bit, or moving to an example from the Philippines. So it's my pleasure to introduce Dr. Gloria Balboa, who is an undersecretary in the Department of Health, and who will be speaking about the inclusivity and the diversity that you are creating in the implementation of the EMT strategy there.
No. Hello. This works. Okay. Yeah. Sorry. Okay, thank you very much. Wait. Yeah, thank you. Yeah, well, I'm thankful for this opportunity to be able to share with you what we have been doing in the Philippines in addressing the issue of EMT inclusivity. Okay, well, effective EMT inclusivity can be achieved It's not working. Okay. Hello. Okay, let me just use this one. Okay, just like what I'm saying, effective EMT inclusivity can be achieved by fostering local representation, gender diversity, and prioritizing the vulnerable groups in EMT development. Okay, in the Philippines, we have what we call the Barangay Health Workers Program. Barangay is the lowest level of unit of governance in the country. It's similar to village. So we use, or we get representation from the locals, from the community, to become members of these barangay health workers to serve as first responders during emergencies and disasters. And yeah, they would be the one providing essential health services. Okay. And what is good here is that they are from the community, so they know the area, they know the culture, they know everyone, so it fosters trusts, and they know the appropriate interventions that will be done. Okay, now, a very good example is when we had COVID-19 pandemic, we made these barangay health workers as part of what we call the Barangay Health Emergency Response Teams. And they have been very effective in doing the initial assessment of the patients, in doing triage, testing, and then referral to appropriate health facilities. And also, since there are a lot who are into home isolation, so it's this BHERTS that goes to their homes to monitor the status of the patients. And really, they have helped a lot during that pandemic. Now, well, what is also important here is when we involve the locals, members of the community, they're involved in critical decision making, especially in those coming from marginalized and minority groups, because this will shape policies that reflect the needs, the actual needs of all the communities. Okay, and then second is we integrate gender sensitivity and inclusivity in EMT policy framework, and prioritize EMT deployment in areas that have limited healthcare access. Okay, to promote gender sensitivity, we recruit and train female health professionals. In fact, the BHWs most of them are females, and because this is not only fostering inclusivity, but it also addresses the issue of gender, health-specific services or needs during emergencies, especially reproductive health. Okay, and then we have to really capacitate those vulnerable groups or areas because, like for example, those in the conflict zones, those in low-income areas, and those highly affected by climate change. And in so doing, we are able to sort of close the gaps in response equity. So, so far, those are the things that we've been doing in the Philippines. Thank you very much.
Thank you. Thank you. And I think very, very impressive and interesting model about how the EMTs are integrated into the community response. Very, very interesting to hear that and much to learn. And of course, congratulations again, because Philippines had the 3 teams certified yesterday. So we're going to move again to another setting. And it's my pleasure to introduce Dr. Hande, who's the the WHO representative from Azerbaijan, where she has also participated in response to many natural disasters and conflicts. And we'll be hearing a little bit how work around the EMT initiative is developing there and how you are applying this governance framework. Please, Dr. Hande, over to you.
Thank you. Good morning, everybody. Yes, it is a different perspective. I'm going to be giving you the life of a WHO representative in a country in terms of what we can do in this area of work. Let me just start by saying that it all started on a hot day in July in 2018, when my Director General, Dr. Tedros, visited Azerbaijan and had a meeting with the President. At that meeting, I was also present, and the President asked for support from WHO for setting up EMTs. And that was a very direct want from the highest level of the government. So we thought that, we could just do it tomorrow. That was July 2018. And that willingness, the political willingness, has not faded away. It's actually still there because we saw it coming, but then you know what happened after 2018, right? So COVID came and our lives changed. But when my regional director, Dr. Hans Kluge, visited again the country in a couple of years' time, a very similar dialogue took place again. So I'm saying this to emphasize that because we all say that political willingness is paramount, which it is, it may not be enough to take speed as much as we want things to go in a speedy fashion. And it's nobody's fault. It's really the systems are not set up to elaborate or to facilitate collaboration, intersectoral collaboration, interdisciplinary collaboration. It's not easy. I'll give you one example from the UN community. WHO, we are part of the UN country team in Azerbaijan. And as part of the UN reforms, we are encouraged strongly to collaborate with other UN agencies, right? So we are asked to collaborate in joint work planning and project management, etc. And we want to do that, but we have no infrastructure or the system set up to do joint work planning, joint budgeting, joint reporting, etc. So however much we would like to do joint work together, the system is not really set up for that purpose in mind. And it's very similar in government agencies and ministries also. It's really not enough to put different ministries in one room and say, okay, work together, which is in a way what the president had said, work together to make this happen. But then it's like two different machines going into same direction, but with different routes, with different systems of machinery, etc. So I think that is an area that we are not really looking into a lot in trying to get people to work together. We went through centuries of specializations, right? As science grew, like medicine and healthcare system also went into specialty tracks. Now, but we are facing these wicked problems where there are more than one reasons of such problems, and these are interdependent reasons. And now we're looking at problems from a different perspective, and now we're saying we should get together to work on this problem. Like the One Health approach is one example of that, or like health in all policies. These are the approaches that we are taking, or collaborative surveillance, for example. We are trying to get people together to help them work together again, and we are struggling there everywhere, in the countries or at the global level. So this is one of the challenges that I'm seeing. We cannot do this alone. We have to work together. We know that we are good people, we want to work together, but we are missing something. We are missing a piece of the puzzle that allows us to work together. So that systems perspective is very important. Other thing we saw in the country is working together with a partner country. It really makes a lot of difference. We are talking more and more about trust now, especially in the post-pandemic period, trust to governments, trust to other partners, for people to actually act like one and for the same vision. So trust is also very important in bilateral relations. What we do, there is a historical trust between Turkey and Azerbaijan. So in this case, Turkey has been supporting the Azerbaijan case with their emergency capacity, EMT capacities, and we are seeing a lot of good examples, advancements out of this partnership, because having a partner with you who has done this before, who has made mistakes, we all do, and sharing them with you is a empowering situation to be. And it's like simulating, it's like a simulation game. Somebody else played that game and made mistakes. Now you're seeing it and you don't want to make the same mistakes. So that's a very good approach from what I've seen at the country level. And the last message is setting up systems. I think in setting up the systems, consistency is challenge. Because if you have the right people at the right time with the right infrastructure, right skill set, etc., it's easier to save lives. But you have to do this over and over again at the same quality, using the same systems, with a continuous financing structure. That is where the challenge lies. So, and this is it's a systematic challenge. I've lived in Switzerland for a long time, and the Swiss are excellent in organizing country fairs. So you go to a little village, you know where you're going to park your cars, you know where the shuttle will take you from. They have the, these sanitary facilities that they put up, and it's amazing that the system that they do this, and they do it over and over and over. It's like, it's a nice thing to see. You can imagine how they will respond in emergencies, so it's also sort of an extrapolation. So let me just stop by saying the three things again. We cannot do this alone. We need partnerships. We need to work, systems to work intersectorally. And the second thing is partnership between countries, bilateral or polylateral. It's going to create wonders in just building up the trust and helping set up systems. And in setting up the systems, consistency is challenge. Thank you.
Thank you. Thank you, Dr. Hanne, and I think really some very wonderfully clear messages around the systems approach, also around the value of sort of twinning or country partnership in the capacity building. And one of the things really that obviously also I think this is an opportunity here at the global meeting is really to learn across the regions from the approaches we take in the capacity building, right? Which is such a key aspect of the 2030 strategy, and to realize it, we really all need to work together. Thank you. And then one of the questions which I'm going to try and open it up to the floor as well, so I'm going to ask you to think about this already a little bit, is the question, how do we maintain the political commitment, right? Because as part of the strategic objective, one is also the advocacy for the initiative. And we need this political buy-in, and and I don't want to say everybody wants an EMT, but it's easy to see how an EMT, as a political leader, in a moment of a crisis, and I've experienced this at national level in my country also, you get an ask for it, but it's very hard to sustain that, to then really implement and build the systems that you need to deliver that quality care consistently. So how do we maintain that political commitment over a time? So fantastic. Thank you all already for your contributions. And now it's my pleasure to come to Dr. Jerry Chandler, who's from Haiti, who's got a long history and experience there in responding, including to the earthquake in Haiti in 2021. Much experience of the air ambulance also, and disaster medical, and a specialist in disaster medicine. And you're going to talk a little bit about innovation. So how do we do all of these things and we innovate at the same time? Please.
Thank you. Yes, I think it's working. Yeah. Okay.
We can hear you.
Okay. Thank you. Thank you for having me, and I'm very happy to be along with these esteemed colleagues and talking about innovations and the implementation of the Strategy 2030 is really a very, I would say, important but also interesting topic because it's multifaceted, I would say. Indeed, as you said, from my background, I have been in theaters of operations, if I may say it like this. I was part of, I've trained with some EMTs, I've trained with DMATs. I was lucky to be a part of the coordination of an operation where there were multiple EMTs involved. So I've seen EMTs at work, and I have worked with them as well. And I've seen the evolution and the integration of innovations within the EMT bubble. And right now, I am currently working with an international organization that is also very versed in innovation and the use of technology tools and all of these things. And we are, our specialty, one of our key things is to be able to enable and strengthen partners. So the idea is to be able to look into innovative ways to support systems and partners, thus EMTs. So the idea is to be able to see from a different lens what we call innovation. And innovation within the EMT bubble has been an ongoing process. It's been ongoing, and for instance, if we think of the example that was given by the secretary is the integration, for instance, of inclusion within the work that we do. The use of and the integration in the work with the private sector, just like Z previously mentioned. So right now, I'm very proud to be with some colleagues that are here in this conference to be discussing about MHPSS and its integration within the arsenal, in the toolbox of the EMTs as one more instrument that we can use to be more efficient in terms of EMT. So again, it has been, like I said, an ongoing process. So we think of EMTs as tools in research and development, and indeed, there are multiple avenues. For instance, if we think of, I can take a few examples. If we take data collection and analysis, for instance, the use of internet and the use of Internet of Things, so tools that can allow us to pick up information, collect data, and if we, for instance, use those data responsibly in this type of AI for good initiatives, we can collect this data, liaise this data with the academia, and then try to identify trends, understand how it works, understand how field operation works, and so forth and so on. So this could be one of the examples. Telemedicine, for instance, and virtual health. We have teams that can be in remote places, completely isolated, where you come across cases and situations that are completely particular. Then the use of telemedicine or virtual health gives the patients access to specialized care or specialists that are not necessarily physically present, but that can support and help the team in its operations so they can alleviate the situation of the patient. The use of drones and automated deliveries, which is becoming more and more common. And for instance, when we think of the national EMTs and situations where we do have delicate response situations and difficulty of access, so these type of tools can be integrated and used. Again, like I said, there is a host of technological tools, and I must congratulate most of I've visited the booths in the conference, and I've been seeing a lot of partners that are exposing new technologies, new tools, and I must also send a particular congratulations to our host nation, because I've seen their civil defense booth as well, with all the tools and the technology that they're using, and that we can look into to integrate some of these technologies in our operations in terms of EMTs and what we do, and make our operations more, I would say, strengthened, if I may say it like this. Innovations can be also used in terms of training and capacity building. So innovative, I would say, continuous training. So you're using virtual technology to train teams. And when I say train team, when I think of capacity building, I'm also thinking about the Caribbean. I am from the Caribbean, and I know that we do have multiple islands, multiple nations that are pushing, really making a tremendous effort so they can finalize the training and validate their teams. So the use of technology can be a plus in certifying those teams, helping them achieve that level of excellence, and keeping current with the ongoing technology. So, and one of the other thing is multidisciplinary simulations, getting the teams in these virtual bubbles where you can create scenarios, create I would say events or situations that they would eventually encounter on the field, so they can react to that. So we can talk about a host of technological, I would say, marvels that we can use, but we also need to think of technologies not just as research and development, but we must also think of technologies as processes, for instance. I've mentioned MHPSS as a new process or a new tool that's being used. And if we want to think out of the box, like they say in English, we can think of innovation in regards to EMTs. For instance, if we think of the maritime network that exists in the Caribbean, why not establish a dialogue with them so we can capitalize on their capacities, their availabilities? And the simple practical example would be this. We would use boat number one to move a team from point A to point B, and then we would use boat number three to move them back when they demobilize. So at this time, so what it does is that these boats are probably present in the area where these teams originate their operations, and then boat number three would be in the area where they need it to be, so it can be mobilized back. So that reduces the carbon footprint, and that helps us achieve our objectives, which is capitalizing on like I said, using multiple partners, but also achieving those goals in terms of climate change and all these things, so we can still be operational, be efficient, but doing that in a creative manner. So, and that example that I gave regarding the maritime sector can be applied to the aviation, to WASH, to multiple sectors and multiple venues and avenues, so we can strengthen and streamline, I would say, the operations of the EMTs. Last but not least, we must also think of innovation. We must be cautious with innovation. Cautious in the sense that innovations must not be an excuse to create a divide between teams as well, because you might find, we might be in a situation where you have teams with greater financial means or resources that can develop and integrate technologies that are all the way up there, and then other teams that are, and the idea for us right now, and this is one of the key themes of our meeting, is interoperability. So we need to be able to communicate with each other, we need to be able to work with each other. So at the end of the day, even if we are implementing new technologies, we are using, I would say, those tools and techniques, we must make sure that we are all working with the same standard operating procedures, and all that is validated as innovations is validated as a whole, as for all EMTs, so we can all be more or less at the same level and progressing at the same level. And this discussion needs to be done at the strategic level as well, Secretariat, and we need to think about what are the next steps in order to be able to move forward and achieve and attain our objectives, which is the implementation of that strategy 2030, which would put the EMT bubble and the EMT environment in a better position so we can serve the populations that we actually are looking forward to support. So those will be my remarks, and I'll be glad to exchange about it. Thank you.
Thank you. And so I think obviously the standardization is important, but I think also highlighting the opportunity for innovation that exists in a crisis and in a response. And I think we've all seen that, right? And so I come from a national public health level perspective, and you mentioned the telemedicine. I think what I've seen in terms of the acceptance of telemedicine that has accelerated over the last 4 or 5 years is unfathomable, and the same perhaps also in the field of genomics, right, which might not be immediately applicable to EMT, but it just really is definitely something which means that the EMT as a community has this innovation aspect. So I think we've heard a lot of different perspectives around how we realize the strategic objective 1, and I would like to now open it up to the floor a little bit. I would like to ask you, come back to that question, how do we maintain the commitment of countries, of our leadership? As one of the questions, I would also invite sharing your perspectives around how we create opportunities, but also some of the challenges you might see. And I'm actually going to put one person on the spot who I think has just arrived and joined us from Mexico this morning. I wonder if I can ask the colleague, Dr. Gabriel Garcia, the General Director of Epidemiology from the Secretariat de Salud in Mexico, if I could ask you to make some remarks, put you on the spot, and thank you for joining us.
Yeah, thank you so much. I got to switch to Spanish. So, quisiera, do you have a translator? No? If you want. Okay.
Somebody grab some number of microphones for us?
Yeah,
the translation is available via the headphones at the back of the room.
Sorry.
Thank you so much. It's better for me in Spanish, but I try to do it in English.
Minutes.
Yeah, of course.
1 minute.
Okay, I wait.
Anna, I want to say a few 30 seconds.
In the middle, I want to appreciate
just 30 seconds.
this opportunity. So I have the opportunity to work to Jerry Chandler in Haiti, just in 2 years ago in the earthquake in Haiti. So it's very.
Thank you so much. Am I the only one who doesn't speak Spanish?
It's a great man, but also their experience in the field is very interesting. See how it works with the EMTs in all the country. So their explanation is very important for me. So I'm going to switch right now, but quisiera agradecer a la organización. Uno de los temas que quizá sea más importante para México es justamente, lo decía Filipinas, con la implementación y la integración de la sociedad. La integración de la sociedad para el desarrollo de la iniciativa de los EMTs siempre va a ser muy buena. La experiencia que ha tenido México justamente, y lo vivimos también en Haití, por eso empecé con ese comentario. La sociedad trabaja mucho para que esos servicios se den y para que la implementación de la iniciativa se desarrolle. Recuerdo mucho, justamente en Haití, fue el primer despliegue del EMT México de forma internacional. Y en ese despliegue, la sociedad colaboró para que el EMT llegara a donde tuviera que llegar. Sin la sociedad no hubiésemos podido participar en Pestel, en aquel entonces, en una de las provincias más lejanas de Haití y quizá más dispersas y con población más vulnerable. De tal forma que coincido con Filipinas en que la sociedad es una parte fundamental para la colaboración, desde la formación de observatorios sociales que nos puedan ayudar a tener un empoderamiento en el gobierno sobre todo, pero es más que eso, que se pueda generar esta necesidad de que los EMTs sean una estructura de gobierno que nos pueda, que pueda expandirse y que pueda tener mayor gobernanza y que pueda tener una identidad, como lo es hoy las estructuras físicas de los centros de salud, los hospitales generales, los de alta especialidad. Que se identifique por parte de la sociedad la necesidad de tener este tipo de estructuras para hacer frente. Sobre todo, en número uno, creo que es muy importante el cambio climático, lo que hemos estado viviendo en los últimos años, los últimos 20 años quizá, con la pandemia de influenza en la época de 2009, 2010 y ahora en COVID-19. Y que ahora estamos viendo un cambio biológico en la mayoría de los patógenos que nos afectan a los humanos. Hoy tenemos no solo una emergencia regional en las Américas por dengue, sino de forma global. Y eso es lo que tenemos que mirar hacia el futuro para la implementación. Estos cambios, al sumar una salud a las estrategias. Y creo que es una parte muy importante que hemos discutido en la Organización Mundial de la Salud, no solamente desde el ámbito de los equipos médicos de emergencias, sino también en otros sectores como es la vigilancia y la inteligencia epidemiológica, y que tienen que estar sumadas en esta iniciativa. De tal forma que los equipos médicos de emergencias deben de ser sumamente resilientes y adaptarnos y crecer y mirar más allá de solamente tener una buena infraestructura, de solamente tener estándares operativos para todas las cuestiones, sino también ir más allá y pensar en la innovación, y creo que eso es una parte importante. Pero además de eso, la compartición de información, y me refiero a esto en establecer mecanismos que nos permitan tener la información de todos los pacientes que atendemos en la emergencia y que nos van a permitir la mejora continua, es decir, sistemas integrales de gestión de calidad. Entonces, ese es otro de los puntos, de las piedras angulares que me parece que son sumamente importantes para que la iniciativa vaya creciendo. Entonces, creo que hasta aquí dejaría yo mis comentarios, felicitarles a todas y todos en el panel. Creo que la iniciativa nació muy fuerte en Europa, pero hoy vemos en América que ha sido sumamente fundamental el crecimiento hacia los países, sobre todo de Centroamérica y Sudamérica, que se han fortalecido mucho. En México tenemos 2 EMTs, un tipo 1 y un tipo 2, que estamos ya, esperamos ahora sí ya en este enero, febrero clasificar, por lo menos ya tener el aval, digamos ya nos preverificaron, nada más nos falta clasificar, pero dejaría solamente eso, una salud, innovación en sistemas de intercambio de información, de vigilancia sobre todo, ¿no? Que es importante, no porque tenga yo la expertise de ser el director general de epidemiología en México, sino porque el cambio climático cada vez nos va a ofrecer mayores retos hacia esa vertiente. Muchísimas gracias. Hasta luego.
Thank you very much. And again, very many important points about the need to partner or really have those partnerships also around the data and where the EMTs fit in, but also this essential point around trust, right, and the connection to the community. And I think that at the heart of the 2030 strategy is also the development of the national teams, right? Because there's something about that integration. So I think we do have I'm going to come back to one more round to the panelists to respond or offer further comment. But before that, I do, please, I think we have time for, I can see 3 hands. If you make your way, 4 hands. If you make your way to the mic, I think we can take them. I'm not going to give you order. We'll take the 4 comments. And then I'll come back to the panel. So if you introduce yourself also with your name and where you're from. Please, yeah, the floor is yours. I will not allocate order, but I saw 4 hands from 4 gentlemen. Please.
Dr. Adil Al-Shamri, I'm the National Medical Preparedness and Response Program and the chair of the UE emergency medical team. Actually, I'd like to thank the organization committee and the chair of the panel and the attendee. We actually have an experience here in UAE. We started to set up the national EMT program, and to do this, we actually have created a partnership between the government, private, and NGOs. So we create what we call a readiness program, which is Jahaziyya in Arabic, which is a national medical prepare and response. So we work with the government, with the private, with NGOs, through one body, through a program initiative, because we want to make sure that we're not restricted to the government, not restricted to the private, not restricted to the military or NGOs. So we make a consortium, and we found this model is very successful. In a few years, we were able to train 15,000 health professionals. We were not able to do that when it was initiated either by the government or private or NGO, but when we put them together as a team, we were able to ensure that everybody feel the ownership of this program, everybody feel that they are a part of this nationals, and also they enjoy the success of our volunteers, our medical reserves, our EMT, that either belong to the civilian or military or private even sector or the NGOs. These models, we are also working with internationally. We have signed with Egypt to make Egypt a readiness program. We are working with African country to do so. The models that we create fit in your strategy, and we are very honored to be here because when we get a WHO and the EMT and a community like you have put this as a strategy that will empower us and UAE to bring more partnership to ensure this partnership sustain. And not only we are target to train all the first responders in mass casualty, in incident command, in management and operation of field hospital mobile, we standardize the training across the whole country. Uniform, standardized curriculum, so when they respond as one team. Then we enlist them, the 15,000 health professionals, civilian, non-civilian, we list them in a database. We call them the UAE National Medical Reserve and UAE EMT. So we have a database, so if there is an emergency within the UAE, we can provide the government and private list of the pre-trained staff, pre-qualified, pre-certified, not only locally, but international. So I'd like really to thank you. And the only thing we want to ask you, if we, list our EMT program from UAE within your WHO program, initially was limited to Ministry of Health approval. Now I can see with your strategy, you encourage NGOs, private, to set up a team, to be part of the national reserve, to be part of the global reserve, especially our program even participated in Turkey, in Morocco, and different earthquake. So the question is, as a program, can we enlist it as a program or should be through government or private or NGO arms? Because we are a consortium. Thank you.
Thank you, and it's wonderful to hear those achievements in UAE. I think the strength of the EMT initiative is the very many different governance forms we take while adhering to the same standard and the quality of that standard that obviously the classification process upholds. So I think that is the value and the sort of gold standard and the real benefit that the EMTs bring. Please.
Thank you. I'm Dr. Herbosa from the Department of Health of the Philippines. And I'd just like to add to what Undersecretary Balboa talked about. The other one we have to mention is that in the Philippines, we have a very strong private sector. In fact, they collaborate together, and it's called the PDRF, Philippine Disaster Relief Foundation. So they put themselves together in a foundation, but there's still struggles. That's why I wanted to ask AMI how the engagement is with government. Because unlike the UAE, when they put it as a national roster, the private sector wants to be independent and not be under the regulatory power of the government. The other thing is they also want the government's resources to be utilized so that they can go to areas where government cannot go. So I think we need to create a model of public-private partnerships for EMTs that can be successful in different countries and different governance situations?
Thank you for that question. Very important governance question. So if the gentleman first here, and then we'll have you. Thank you.
Thank you very much. My name is Skender Sula. I am representative of World Health Organization in Kazakhstan. Indeed, my lifespan with international organizations started in humanitarian crisis in my own country, in Kosovo, where we supported people in need that were affected by war. And again, me as a refugee in Northern Macedonia, I continue to lead mobile team clinics. But this is not the subject that we are discussing. I'll try to answer your question, Johanna. What we need to keep the political momentum in order to engage ministers of health, but also ministries, other ministries, in order to engage or to initiate EMT services. In Kazakhstan, the country that I represent on behalf of WHO, we are in sensitization phase of this process. We have had national workshop. We had also follow-up, but going back to partnership, we need to use key opportunities that are, for example, WHO is implementing partner of Pandemic Fund, which is a project that will last for coming 3 years, and there is substantial funding. It's about $20 million because whatever activities we do at country level, we need also to have funding. How do I see in the country context? And I'm very thankful for all the knowledge that I gained through this, because we need to follow also what would be the mega trends in the future, in near but also long-term future. We spoke a lot about innovation, but we need to think also out of the box. Urbanization, smart cities, aging population, lack of human resources for health. When I'm saying lack of human resources for health, right mix of human resources. And all this, when we discuss with key ministries, needs to be taken into consideration. We had a great workshop with Oleg in country and introduce this, but this is not enough. How do we need to keep this momentum? There is continuity, there is persistence, providing evidence, but another stage, I think that we need these high-level policymakers also to expose to study tours to other countries to see the entire process. I'm still very hopeful, although the key challenges are intersectoral collaboration. For example, this year Kazakhstan faced one of the major floodings over the past decades, and we could see there are many challenges again in terms of communication. I mean, providing very simple, understandable, and useful information to communities. Even some simple information sometimes are not provided in the language that we face also during the COVID-19 pandemic. Translating the terminology of science to the real world that an ordinary citizen would understand is key. But thank you again for opportunity, and I'm quite optimistic that we'll move ahead this agenda in Kazakhstan.
Thank you for the contribution, and it's almost like we need a capacity building or a twinning for policymakers to keep the momentum. And please.
Thank you for the floor. My name is Lázaro Martinez. I'm coming from the Regional EMT Training Center in Addis Ababa. So I'm working for the whole region of Africa. And I would like you to share the example of that the way we are using right now to wake up the interest of African governments to have an EMT. So we are using emergency that are ongoing to convince the governments that the international EMT having a very good performance could be something that they could have at national level. So it has happened in Malawi, it has happened in Zambia, and it's happening right now in Rwanda, related with the Marburg outbreak. So there is even an analysis ongoing in looking at how the mortality has been reduced once the international EMT, in this case Alima, has started working along with the national EMT. And that is an example that is a way where we used to convince the national governments to implement and develop a national EMT. It has happened, as I say, in Zambia and Malawi, and we are really taking advantage of the emergency to convince the government because the level of awareness in related to EMT in the region is very low. And it's not that it's low. Some governments, they know it exists, but most of them, they feel they are not able to have an EMT because it's very expensive. So they relied in international EMT coming that, of course, they take time to come. And in these times, mortality and morbidity increase. Thank you.
Thank you, yeah, and certainly it is about using the momentum of the difficult moments that we have to highlight the opportunities that an EMT provides to save lives, really. So I think we've had different perspectives, differing perspectives from the floor. So I would like to come back to the panel, and I started this way around, so I'm going to go back. I'm going to return the wave, starting with Dr. Gloria. I would like to invite each of the panelists, if you want to respond to any of there were specific comments around the public-private partnership, but I'd be interested also in your perspective. So if I could ask you to make your remarks, starting with Dr. Gloria, please.
Yes, really involving the private sector and having this public-private partnership is very important. And we have seen the importance of their participation, making them on board and engaging them when we had the COVID-19. Because definitely government cannot, handle that situation alone. And with the limited resources of government, we really have to involve the private sector. In fact, they have helped us a lot in communication, disseminating critical information to everybody, public information, public awareness, and also in logistics or supply management, because this is one area where we really need to do a lot of things in the government sector. And then, of course, just mentioned PDRF, they are good partners in providing some donations to us. And then, several civil societies also, they have helped us a lot during that time. So it's a whole of nation, whole of society approach, because everybody has a particular task to do, to contribute in the entire emergency response or disaster management process. Thank you.
I'll take this.
Yeah. So I will just take this back. Okay, Dr. Hande, please.
Yes. Thank you.
Your responses.
Thank you for this opportunity again to speak. I want to emphasize that recognition is also important, acknowledgement and recognition of the work that has been done. So I noticed that I hadn't acknowledged the good work that has been done in Azerbaijan, and I want to just say that we have a team here from Azerbaijan, including my team member who's been doing this work for a long time, Dr. Cevahir Süleymanova is here, and our national focal point for EMTs are here, and the representative from the Ministry of Emergency Situations in Azerbaijan, who is our main leading agency within the government structure. So it's very important that we have clear-cut people, real people who are taking this work on. So I acknowledge their contribution, and I know that they've been actively involved in this meeting here. I just want to say that we've had a lot of the preparatory workshops in Azerbaijan, starting with the WHO mission, the training of trainers, preparation training. We also had the training of trainers. Our teams attended in the EU MODMEX, MedModex simulation exercise in Turkey. So there's a lot happening there. The biggest asset is the people. So there is a great group of young, enthusiastic medical doctors, nurses in the country, and they are really training very well, and they have also been involved in a lot of skill strengthening in medical emergency management also. So yeah, the people, if you get a good group of people who are really enthusiastic to carry this forward, and if you can get the systems working, I think that's the road to success in addition to money. Thank you.
Thank you very much. And again, it's wonderful also to acknowledge the contribution, I think, of it's such an effort, right? That happens at national level from the political side, but also from the national focal points. And now I see there's a colleague who wants to make an intervention. I assume you were just mentioned, so please,
Yes.
we give you the floor, and then I will return. Jerry, forgive me for...
No problem.
Hello, nice to meet you. I'm Alaskar Aliyev from Azerbaijan. I represent the Minister of Emergency Situations. Thank you very much for the opportunity. Thus, I would like to briefly inform you that how the emergency situation is managed in Azerbaijan. All the response activities coordinate the Minister of Emergency Situations. All the activities involved response operations. All the ministries coordinated by the Minister of Emergency Situation, but leading also by the State Commission on Emergency Situations. We have a clearly defined structure in the country that we have interaction plans between ministries. We provide all the operations during the emergency situation in interaction with the different ministries according to the interaction plans. Also, we have civil defense plans. We are going to update now. As you know, the Ministry of Emergency Situation has a medical service. Also, we have sent our medical team to the Kahramanmaraş during the earthquake, and we established 2 hospitals there, and we provided medical assistance more than 3,000 people. And now we are going to have classified emergency medical teams, and I would like to thank the WHO for its support in this issue. And I'd like to ask a question, what is the plans to support us in this issue by the WHO for the future? What will be your support, and what do you think about future corporations? Thank you.
Thank you.
Thank you. So thank you for the work, and also we can see the commitment at the political side. So Jerry, if I come back to you, please, your comments on.
Yeah, rapidly, I could say that I want to go back to the experience that I had on the field with our colleagues from Mexico, and it was indeed very rich and very particular. But what it was all about adaptability, right? And how to be flexible, not only from our side, because back then I was part of the coordinating body, but also from the team's side, so they could adapt to the conditions, the situation, what was going on, and how we could have that dialogue to figure things out and make it work. And again, this can also be part of innovations, because the experience that, while I was doing the coordination, the experience that I had with the Mexican team was not the same as the Norwegian team or with Samaritan Purse. So again, thus the importance of being able to capture all of these experiences so we can take the lessons learned and be better next time. That being said, I also want to acknowledge the various examples that were put forward. Our colleagues from Abu Dhabi who really are innovated by having public, private, and NGO at once, so in order to build the system. And also our colleague from the African region, where they have a different methodology of capitalizing on ongoing emergencies to build up. So the idea is the idea of all of this is that there is no one-size-fits-all formula. It is about adaptability, about flexibility, but also about dialogue, being able to communicate, figure things out, get everybody on board to keep going forward towards the goal.
Yeah, thank you. And all while keeping the standard, right? I mean, is that tension, but really important point also, and I think highlighting what your contribution also highlights is this need for the operational research, which is of course part of the strategy, right? Of the I'm going to say it's the 5th objective, I don't know, but the fourth, okay. But is about documenting and learning as we go along, right? Because that is so vital to then have the transparency and do the learning. So the very specific question to you around the public-private partnership, how do you do the regulation too?
Sure. So I think one of the things I want to start off is currently in the EMT classified teams that are currently classified by WHO, you're looking at about probably 2 or 3 private entities on there. My prediction at the 7th WHO EMT meeting, that number is going to probably in the double digits, if not much higher than that. There's a lot of interest in the private sector to be involved in the WHO EMT initiative. From a private perspective, I can tell you there's a lot of interest to get involved in that. And secondly, I think the specific question is, how does AMI continue to maintain relationships with I think politicians or federal governments or state governments, right? One of the things we do is ensure that we have MSAs, and for everybody in the audience, it's called a Master Service Agreement with the federal government in the United States. And what that means is we get activated when there's a disaster in the United States. If they need us. If the current structure, what we have in the States, which is equivalent, it's called the DMAT teams to the EMT, if they're overburdened or there's not enough personnel available, the secondary would be to activate the private sector. Right now, the DMAT teams are, the challenge they face is they can only be deployed for 21 days, whereas the private sector does not have that challenge in its way. So the private sector can stay on for 6 months or longer if it's a long disaster that needs recovery. I think that answers that. And we do work with state governments as well when they face crises, whatever it may be, whether it's war or whatever. We do get contacted because we've worked in those countries and they know us.
Okay, so you have clear agreements, and I wonder whether one of the things that comes out of this session is the need for a working group to work out the type of public-private partnership governance structures we need to enable the integration more fully. So I'm not sure whether Camilla is taking note of that point or a different one, but I'm going to try and take that forward. I think it's definitely clear that you need very clear, transparent regulation. Okay, so very concrete point. Thank you. So Steiner, please.
Thank you. I find this very inspiring, knowing the diversity in the landscape throughout the world. This meeting is like a treasury chest, a lot of different solutions that can be tailored to fit the solution you need in each region. So therefore I find it's very, very useful to be a part of this. And I think we should partnership across countries, across sectors, across government and private sector. So let's keep moving on and keep this going. This is what we need. Thank you.
Thank you very much. And I think then I have 1 minute to summarize an incredibly rich discussion. So I think I'm going to start off by saying, just can you give a hand for my fantastic panelists? I think treasure chest is the word for this. So I'm very grateful for this. I think we have heard around the importance of partnership, around the systemic approach. I think very clear also that we need clear information and the transparency, because that really enables this partnership so that things don't go all over the place, but in a way that the roles are clear. And I think the framing that the 2030 and then the regional action plans can give us is a framing around that. But I can also see how we need to go even further in articulating some of that. But I think the need for the clear information is essential for that. I also heard about adaptability and innovation. I think these are all massive opportunities that the EMTs present. And I think vital also in this partnership is widely different partnerships, right? So with the private sector, but also how we engage the communities and the different models we do that, and all to keep the commitment. And I think in the commitment also the partnering between countries and across countries will help us empower that. So thank you again for a great session. Thank you to the Secretariat for organizing it, Oleg, Camilla also for presenting, and thank you again to the fantastic panelists for their contribution and also their commitment to the initiative. Thank you.